that I now introduce the renowned cardiologist and entrepreneur, Dr. Devi Shetty, immensely respected for his ingenious ideas of reforms for the healthcare sector. Dr. Shetty's visionary leadership to make quality healthcare affordable for all has drawn global recognition. Dr. Shetty, I invite you now to share your perspectives on how to expand the capacities of healthcare systems to deal with COVID-19.
Thank you so much. Thank you so much to ECHO for giving me this opportunity. So since the time is limited, I would like to briefly talk about various issues. One is the short-term and the long-term planning of healthcare manpower. The first of all, my sincere request to all the healthcare professionals, especially the senior healthcare professionals, to protect the healthcare workers. This is extremely, extremely important. At times we can get carried away. One of our senior intensivists, he was resting off his duty hour, a room upstairs. Then something happened, someone called him and he rushed to the ICU and he attended a patient without a mask, without the PPE. He was obviously dedicated senior intensivist, and a week later he was positive and he was out of action for more than 1.5 months. Now, what is important? Is it important to help saving one life, or being alive and fit and take care of hundreds of people on a daily basis? Because we cannot, in a short term, we cannot have more healthcare workers than what we have. And this battle will last for a few more months or maybe a year. We don't know. So it is very, very important that everyone thinks about how to protect the existing manpower. Now, what is the reality? The reality is that when the COVID battle started, we had no idea what we are fighting with. We had absolutely no clue about what the enemy is, what the enemy's strategy is, because it's only a 6 months or 8 months or hardly 6 months old disease. So we did our best, and hats off to the government hospitals. They did a fantastic job in the phase 1, taking most of the brunt. Now, government hospitals, government doctors are tired, fatigued, and they're burnt out. Now the entire load is getting shifted to the private sector. And private sector is doing a phenomenal job. Right now we have close to 380 COVID patients in our healthcare, in our hospital campus, 380 patients. And we have more than 80 or 90 in critical care unit. You can just imagine the brunt borne by the private sector now. 130 of our doctors and nurses are infected. So this is the current situation. Now, essentially what is going to hit our country in the next few weeks and months is the acute shortage of doctors, nurses, and technicians. We always read in the newspaper that there is no bed available. There is no bed available in the government hospital or the private hospital. There is enough and more beds, but sadly, beds do not take care of the patients. It is the doctors and nurses who take care of the patient. And that is that's in short supply now and even in the past. So unless we take a very dramatic decision about empowering people who are currently not empowered to take care of these patients, we may land in trouble. I hope and pray to God that we will withstand this onslaught of COVID for a few more weeks or a few more months. But if we are not able to, we have a hope. We can produce large number of workforce by changing our regulatory requirement. First thing is about the nursing. Fortunately, COVID behaves in a more or less predictable manner now, wherein it goes from one city to the other city, one town to the another town. And when one particular city gets bombarded with COVID, gradually over a period of time, it reaches a plateau and the number comes down. So these towns and cities require a maximum number of assistants when the problem has hit the peak. So we need a fluid workforce of at least 1 to 1.5 lakh nurses and at least 50,000 doctors. These doctors should be young, they should be technically skilled to manage a patient in the ICU. It's totally unfair to send qualified MBBS doctors who have never worked in the ICU first time to a COVID ICU. Leave alone them being helpful to the patient, they are a liability to the institution and to themselves. So we cannot make those things happen. It's not like this is the very unique time when the healthcare workforce have to take care of their life more than the patient's life. So it's a different kind of a mindset we need to have. We believe that the young doctors, young nurses are ideally poised to take up this job. Now, if the government decides that the nurses who have finished their 4 years of BSc or 3 years of GNM, who are waiting for their exam, if the nursing council and the health ministry decides that they don't need to appear for the final exam, what is exam after all? They have finished their training. They're not going to learn anything in exam. It's just a certification. If they are told that you don't need to appear for the exam, but you all should commit to work in a private or a government hospital managing COVID patients for 1 year. Believe me, we will have, even if there may be about 1.5 lakh nurses, even if 70,000, 1 lakh nurses volunteer to work, it's a huge workforce. And this is what was done in many countries. And why can't we do that? The other important source for the doctors, we have over 25,000 doctors. In the final, they have finished their postgraduate training in general medicine, in pulmonology, in anesthesiology, all these specialties, under MD or DNB courses. Now, if they are all told that this year there is no exam, you all have passed, provided you work in the government or a private hospital for 1 year. Even if half of them volunteer to work, we will have a very strong workforce. So this is something we have the option which we can do it, provided the situation requires it, and I'm sure government is well aware of these possibilities. The other important changes we need to do is to use the technology. Today, when a patient is in the COVID ICU, nurses have to go every few hours, check the blood pressure, check the pulse rate, check the temperature, check the respiration. All this can be automatized. All we need is a telemetry device, which hardly costs some 20,000, 25,000 rupees. You attach to the patient. It can continuously give the saturation. It can give the ECG with the analysis, and it can even calculate the risk score. These technologies are available. So nurses need to touch the patient should be brought down significantly. And nurses need to touch the patient only if they have to do a procedure on the patient. Supposing the patient his position has to be changed, he should be ventilated, then it is inevitable. But just getting the data from the patient, pushing the nurses to do it, I feel with the technological tools what is available, we can address it. And also other advantages with the data coming from these machines, senior doctors who are not supposed to enter the COVID ICU can still sit in the comfort of their house and manage hundreds of patients in remote locations. So about the long-term plan, the COVID has given a very clear message that we have to address the shortage of doctors. Now, as you know, medical college costs 400, 500 crore rupees to build and over 150 crore rupees to manage. Is it really required for this investment? So all we have to do is double the intake of the existing medical colleges. We have over 500 medical colleges. If we tell all the medical colleges, instead of taking 100 students or 150 students per year, you take double the students. And the preclinical education should happen in the existing infrastructure. They got 20 acres of land, massive infrastructure. They can easily train double the number of students. And each medical college should adopt one of the government hospital. Especially there are 740 district hospital. Each medical college can adopt one of the district hospital and convert it like a medical college. So one medical college with 2 campuses can easily double the, instead of taking 60,000 students per year, we can take 120,000 students per year at very little infrastructure cost. Thank you very much for the opportunity. I'm extremely grateful to Prasanna and the ECHO for making it happen.